Really happy to take this opportunity to speak about our learning approach, our approach to learning reviews, and it's very much a collaborative approach and one which we have built up in the city over the course of a number of years now, and it's one that's continually evolving as we go forward. But in terms of looking at this, what I wanted to do first of all was really just look back a little bit. And I suppose I take myself back to when I started in social work back in, believe it or not, the 1990s. I know that's hard to believe. But at that point in time, case reviews were very much undertaken on a single agency basis. And I think, whilst I'm speaking about this from a social work perspective, I know from speaking to colleagues, this would be felt the same within other agencies as well. It was very much done to and not with the staff involved. It was closed, it was secretive. There was certainly a significant element of fear attached to case reviews. Workers used to dread the prospect of a case they were working being pulled for review around that. And they were also associated with blame. I think that sort of sense of looking to sort of apportion blame as to what went wrong and looked at that as well. And at that point in time, there was certainly no link to practice improvement as well. So really that's the context, I think, where I started off in my career back in the 1990s. Moving that forward a little bit then into the 2010 sort of space, at that point in time, we had moved to significant case reviews being undertaken on a multi-agency perspective. But still, at times, it was felt it was done to and not with the team around the child or the team around the family or the team around the adult involved as well. They were hugely time consuming. If you think of some reviews that I'm aware of, one in a local authority just near to ourselves, it took over 2 years for that review to be undertaken. And the time that and the cost involved in that was absolutely significant. And just the impact on the staff involved as well, sitting, waiting for the outcome of that review to be concluded for 2 years puts a huge impact on our staff as well. And we need to bear that in mind. And again, the outcomes of those were still not really aligned to practice improvement as much as we would want it to be, or as much as I believe we are now moving towards. Again, moving forward again in 2017, the Scottish Government undertook a review of the child protection systems. And in doing that, they noted there was a need to move beyond apportioning blame to learning together about what is helping and what is hindering efforts to help children. And at that point in time, they also made a specific recommendation within the review that a new tiered approach to and methodology for initial and significant case reviews should be pursued based upon the use of the child practice review model, which was used in Wales, often referred to as the Welsh model. So a couple of years later in Aberdeen City, we had cause to instigate a significant case review, and we really sought to embrace the Welsh approach, the Welsh model, in terms of how we undertook that significant case review and engaged with somebody from Wales who was very familiar with that model as well. And so she worked with us to think about our approach to undertaking this significant case review. It was very much practice and practitioner led, very much involving them throughout that whole process. It was open, it was transparent, and we sought to involve appropriately the family members of child D who was involved in this. That wasn't always successful due to circumstances within the family or indeed the health of the individuals, but nonetheless, we gave active consideration to how we would want to involve the family members of child D. Whereas I mentioned previously, if utilising perhaps the SKY methodology, a methodology that could take 18 months to 2 years, this process felt much quicker. It was focused on improvement and focused on learning. When I say quicker, it still took a few months, and let's be clear, this is not something that happens overnight, and nor should it. But nonetheless, it felt a much quicker process than it would have been had we undertaken utilising the SKY review as another methodology example. Our learning from this example was very much fed back at a national level and was utilised by the Scottish Government and others in terms of developing the national guidance for child protection committees which was the review published in 2020-21. And that really restated that the overall purpose of a learning review is to bring together agencies, individuals and families in a collective endeavour to learn what has happened in order to improve and develop the systems and practice in the future. And whilst that's listed from the National Guidance for Child Protection Committees, I think that definition equally applies to any practice review that we're undertaking, whether that be within an adult protection context, a drug death related context, or indeed a suicide review context as well. All of that I think is fundamental. It recognises that no one agency has a single perspective to bring to the review, and it's absolutely important we look at those on a multi-agency basis as well. And that changing landscape is very much seen in our policy framework, from the 2015 guidance in relation to child protection for conducting a significant case review. That's evolved into the 2021 guidance for undertaking learning reviews. Similarly, in 2021, we had the National Hub for Reviewing and Learning from the Deaths of Children and Young People. And then just in May of 2022, we had the National Guidance for Adult Protection Committees. And when you read across all three of those recent guidance and national guidance directives, there are very much strong similarities. And in fact, if you tipexed out the adult and child from both the adult and child protection, there is very little difference between the two. The read across is very, very strong and striking when you look at them both. The National Guidance for Child Protection Committees undertaking a learning review identifies a number of core principles in doing so. I'm not going to read them all out, but again, really re-emphasising that a learning review are not investigations. Their emphasis is on learning and organisational accountability, not on culpability. And they should produce learning which can be disseminated so it directly impacts on and positively influences professional practice and organisational systems. Things which I think are really, really important. We need to think about how we continue to develop those as we go forward as well. Looking at the National Guidance for Adult Protection Committees, some of their key features are about that inclusiveness, that collective learning and staff engagement, but also still recognising that the history and the fear perhaps attached to learning reviews from the past still resonates within our staff. And so we need to think about how we support our staff when a review is undertaken. And it's a systems approach. It's also recognising that actually we need to be proportional and flexible in how we actually utilise our learning reviews. It's not a one size fits all, and we need to be adaptive to the circumstances of the individual or the family or the child to respond appropriately. Again, strong emphasis on timing and timelines. When is the right time to undertake the review, but also having that sort of sense of these should be undertaken without being extensively dragged out or unnecessarily drawn out. So those timing and timelines are key features that have to be given in consideration to doing that. Just wanting to think a little bit further about how we involve practitioners, and certainly thinking back over the past number of years since we undertook our first one. I think from a Child Protection Committee significant case review subcommittee perspective, I'm not sure we gave enough consideration to how we involve practitioners when we undertook our first initial case review. And we certainly learned from that. We heard the feedback from staff, and we very much took that on board, and very much now have put the views and how we involve our staff very much at the heart of our planning when undertaking a learning review. It's really important for that review team to remain professionally curious throughout, not to make assumptions, not to be professionally looked down from the ivory towers, but actually trying to be getting alongside our staff and actually have that curiosity in terms of what it was like to work that case. Really important we set that tone with an emphasis on learning, and in doing that there's a critical role for our line managers, the line managers of our frontline staff, to support and really reinforce that focus on learning as well, both in terms of its process and in terms of their contributions as well. It's not also understanding what didn't quite work as we would have wanted to. It's also important a learning review identifies what works well. And it's really important we do that, to value the staff, Nobody comes to our job to do a bad job. They come to try and do their very best. But yet sometimes things don't work as well as we would want it to. But nonetheless, recognising the efforts that staff often have gone to is really important when undertaking that learning review. Understanding how things were viewed at the time, conducting a review 6 months after the event or several months after the event, you can lose the perspective of how things were viewed at that time, as well as putting ourselves into that operational context and really understanding the availability of resources around the child, around the family, around the individual at that point in time. And only by involving our practitioners can the learning review really get that real sense of understanding. It's also important that we share our initial findings first with the team around the child, around the family, around the individual, giving them a sense of what we feel the findings are, but also giving them a chance to influence and refine what those findings are, and really continuing to take on board their views and perspective as well. And by doing that, I think we have begun to shift the dial slightly and reduce that element of fear and anxiety that often are associated in the past with learning reviews as well. Moving on just again a little bit further, that actually we undertake now lots of learning reviews. There is a significant learning review from the Child Protection Committee, the learning reviews from the Adult Protection Committee, and those have got very clear guidance around that as well. But we've also recognised within children's services there is actually at times a need to undertake practice reviews for instances which don't perhaps meet the threshold for a significant learning review. But nonetheless, from a multi-agency perspective, there's still a need to understand what has happened in a particular set of circumstances and identify the learning from that so that we can continue to improve our practice around that as well. We've also got the review and learning from the deaths of children, and that's overseen by the National Hub. And that includes the deaths of looked after children and care experienced young adults up to the age of 26, of which there are particular reporting expectations placed upon those. But nonetheless, it recognises that Scotland currently has the unenviable record of having one of the highest death rates of children in Europe, and how we can begin to actually use reviewing processes and learning from that to actually develop and improve our practices to hopefully reduce that death population, that death figure for our children and young people as well. We've also clearly got and had for the last number of years an explosion in drug-related deaths. And again, recognising that actually it's really important we begin to understand what has contributed, where were the opportunities to interject differently within the lives of those who have died. And we have begun to undertake a number of reviews of individuals who have sadly died through drug-related activity. And that has enabled us to begin to learn and begin to identify really vulnerable groups whom perhaps we need to have a greater level of attention as well going forward. But that is still something we want to continue to develop as well. And also recognising that actually suicide death reviews are also another opportunity to think about how we can actually ultimately better intervene into the lives of individuals who take their own lives. Often these individuals will have had previous attempts on their own life, not always, but in many instances. And have we actually intervened and taken the learning to wrap ourselves around them and differently to enable that to prevent suicide happening in the future as well. So really important as well. There are also significant incident reviews, and these are often relating to individuals who go on to commit a serious offence whilst subject to a community disposal or released early from prison. And often these are come under the MAPA processes, multi-agency public protection processes. So lots of different learning reviews, and there are others, so I haven't listed every one of those, but nonetheless, you can begin to see there are lots of opportunities and learning opportunities to think about how we can improve our practice and develop that as well. So I want to move into our breakout rooms, and I'm going to ask Val to help us do that in a second. And there's a couple of questions which I want to pose to you. So without overwhelming our workforce, how can we more effectively support them to connect to our learning from across the public protection agenda, the learning reviews that we've touched upon this afternoon? And then secondly, how can we more effectively ensure learning from reviews leads to embedded practice or system change? And what are the barriers in delivering this? And what will success look like in this regard? And how could this be measured?